Good afternoon. I'm Sean Smith, and this is Aging Wealthily. I'm here today with my lovely co-host, Ms. Bridget Smith. Say hello to them.
Hello, everyone.
And today we have a topic. Our episode title is From Labs to Loved One, How Public Health Research Shapes Caregiving. And we have as a guest today, we have Dr. Joan Monin. She's an associate professor at Yale School of Public Health. Welcome to our studio today, Dr.
Thanks for having me.
It's a pleasure. It's a pleasure. So, Joan, why don't you, or Dr. Joan, why don't you tell us a little bit about yourself and what you do?
Sure. So I'm a professor at Yale School of Public Health in the Social and Behavioral Sciences Department. And I've been there since 2010. And I actually just got full professor, so I'm excited about that.
Congratulations.
Yeah, I get to stay.
Oh, wow, congratulations.
And I've been doing caregiving work for a really long time. So family caregivers, taking care of loved ones who are older adults, lots of different conditions, chronic pain, frailty, multiple chronic conditions, and dementia has been kind of the most common type of family caregiving relationship that I've done a lot of research on. And so I also do some teaching as well. And you'll hear that I have kind of moved towards doing a lot more community work recently. So it's been kind of an evolution from more inside the lab into getting out into the communities and working with people who are, living through a lot of the things that I've been studying and writing about, but now trying to get it kind of more in the hands of the community with the type of research that I do.
Oh, great.
Yes.
Wow. So what are some of the surprising ways that health research influences caregiver, and why is it in jeopardy?
Yeah, so, if the government is doing things right or kind of public assistance is doing things right, people don't think about, where they're going to get different supports in their environment as much, right? Just like Meals on Wheels, making sure you're getting that food every day, things like access to exercise opportunities, socialization, and especially for caregivers, respite help, so making sure that you have time to go to your own doctor's appointments or take care of yourself, because there's just so much involved with being a caregiver, from making medical appointments, making sure, depending on what your loved one is going through, that they're safe, Right. And so all the resources we have in communities are just so important, and I think a lot of people take them for granted or don't realize like the significance of them until they're in jeopardy,
Right.
which they kind of are right now. So we need to be putting that on our radar of how we can help our fellow community members, or to be more active in raising our voices for the importance of things, like Connecticut Food Share and all these different places that do such an important service for people who, a lot of people who are older adults don't have enough money to actually get nutritious food for themselves or the ability to go to grocery stores. So that's just like one example, but I mean, I could give a lot more too.
I'm sure.
So for a layman like me, could you give a definition of what public health really is and why it matters in caregiving?
Yeah, so an easy definition would be that it's anything that's related to your health that's outside of like the healthcare system. So anything that's outside of the hospital, like outside of primary care doctors, things like making sure that your water is clean, is an example of public health and how it matters for your health, right? But that's not like in the hospital or a doctor doing it. It's making sure that our food doesn't have contaminants in it. So like the FDA and things like that, that's part of public health. And also reporting if there's any kinds of like infectious disease spread, you know, in an environment, understanding how to communicate that to all of the people and taking the actions to make sure that more people don't get that disease. So an example was COVID, right? It's a lot of people finally found out what public health was because they were just like, oh, I never really thought about that before because we didn't have anything like that in our memory at least. Yeah.
So in essence, the public health is spends a lot of time safeguarding the public. In essence, right? And a lot of oversight and a lot of safeguards in place that protect us, the general public, from different
infections. Right.
Yeah. And when it comes to, you know, caregiving and the applicability of public health to that, you can think of a lot of ways that caregivers kind of need support with health outside of the healthcare system.
Right.
And I gave the example of making sure you have food or respite or things like that. But that's all kind of like healthcare adjacent and would be kind of thought about as public health. You know, public health is also about educating the public widely about what is dementia, for instance.
Right.
Because a lot of people will be like, what's the difference between Alzheimer's disease and dementia? You know, as public health educators or professionals, it's our job to tell people what is the difference because it matters of how you would get treatment for that or how you would prevent further cognitive decline. So again, dementia is like the umbrella term of cognitive decline or impairment kind of situations. And then like Alzheimer's disease is the most common kind of pathology with amyloid and tau in the brain that makes people have dementia symptoms.
Right. And I remember a time when, you know, and I see it, I hear it and I see it so much that people just, anything dementia related, they just lump it in as Alzheimer's. When there are actually different types of dementia and the approach and the treatment and even the caregiving aspect, you would approach it differently based on the type of dementia that it is. And they, you know, their, you know, the response and what you would recognize and some of the signs and symptoms even differ. But somehow Alzheimer's became the blanket term for it. And, you know, that I think it's a great job, great that there are educational resources out there that will help connect people with the true definition of dementia and of Alzheimer's and other various forms of dementia as they present. I think that's great work. I think it's very much needed. So how do we differentiate public health from like pharmaceutical or clinical research?
Yeah, so you can still do, you know, clinical research within a public health kind of world, right? And you can still do pharmaceutical type of research within a public health world. The thing about public health is that it's going to be something that affects lots of people. So like a clinical study would be like you're just trying to change patients in this one study, right? A public health approach would be like, let's see if early education influences later on the incidence of dementia. So then we can make policy changes to say that every young child should have a high quality education because it's going to keep our population healthy.
Right.
So that would be kind of like one different thing. Like But sometimes they kind of bleed into each other, honestly, because like when I do emotion regulation types of interventions with families, you could think of that as like a clinical psychology kind of study approach that a professional is doing. But when I make that intervention and it's successful, then we could potentially scale it up to like a very broad population. And in that way, we actually have to do more research to see like, without having like me go into someone's, home and talk to the family.
Right.
Could we have like an approach that's on an app that would be able to get to lots of different families without having those specialists like be so prominent in every environment? Or, for instance, like if we see that having community centers is super helpful for like the morale and trust and like social capital of a town, and we do the research to show like all the positive health outcomes of that, then that would suggest that we should put more funding into senior centers or intergenerational experiences within towns across the country.
Oh, wow.
Yeah, I think. Yeah.
So,
Okay.
is there a crisis at this time when it comes to funding for these types of studies, or even the implementation of the results or the findings from the studies or solutions?
Yes. So yeah, NIH funding has gone down
Right.
dramatically, and a lot of grants are kind of halted for now, and they span everything from, caregiving to cancer research and things like that. And so we'll see what happens, but right now, a lot of the funding is kind of in jeopardy for that type of research, and especially research that affects marginalized communities or, people that probably need a lot of these resources the most.
So, can we talk a little bit about how caregiver health is studied?
Yeah, I mean, it's a huge area of research. So we can think about every aspect of a person's life. But one of the main things when caregiving research started was to look at kind of the stressors that the caregiver was experiencing. So it would be things like, financial stress, or how many activities you had to help your partner with, like bathing or toileting or things like that. And then they would kind of also ask caregivers, how depressed they were, or how much emotional and physical strain it takes to be a caregiver. And then another thing was just the amount of caregiving hours you had to do. And so the early studies would kind of compare caregivers to non-caregivers and look at them over time to see how long they lived. And they found that caregivers were less likely to live, as long as people who weren't caregivers. And the studies also showed that it was magnified if they were saying that they were very distressed about it, if it was like emotionally straining to them.
Right.
Later on, I think we have moved kind of more to what are the positives and negatives of caregiving, because, caregiving is a thing that happens in all of our families. We have a sense of responsibility to take care of our elders. They took care of us, or within spouses, you say, till death do us part, in sickness and health.
Right.
Unless you're Greek Orthodox like me, and I didn't get to say anything at my wedding. They just said I was going to have lots of olives on an olive tree, and those are going to be my kids. But, in general, that's like the thing that people say. And we love our families for the most part, unless you've had, like a traumatic situation. So we can't always be talking about how like caregiving is going to kill you, right?
Right,
We had to be like, okay, well, what are the things we need to be successful at caregiving and take care of ourselves?
Right.
And one of the things I'm really interested in is the bond between the caregiver and the care recipient, because it's not enough to just be like, let's take care of caregivers. We got to take care of both people, and we have to understand how they're influencing one another.
Right.
And a lot of my research that I kind of became known for was this idea that if you think your partner is suffering, that's the hardest thing about being a caregiver and makes you the most depressed.
Oh, yeah.
Like if you feel like there's nothing you can do to stop your loved one from suffering, that's like one of the most painful things that a caregiver can go through. And sometimes caregivers will like overestimate the suffering of their loved one.
Oh, yes.
Because they don't want to poo-poo anything, right? And they also just like don't know what it feels like to be the other person, and might not be able to communicate it to you. So a lot of it is trying to help people understand how to regulate their emotions in the face of like someone's pain or negative emotions, and kind of reframe it so that you have a more compassionate response. You don't want to be like avoiding or like distancing, but you also just don't want to take it all on you. Right. Because then you become emotionally enmeshed and there's no difference between the other person's pain and your pain. And that's a really hard thing to have to deal with.
Yes, I would definitely say so. So let's talk about the reality, because funding is it's huge. It's a huge part of this, right? There's no funding, there's no research, there's no studies. So what are talk about some of the difficulties in relying on philanthropic efforts to help fund this research and all the things that you guys do in the department?
Yeah. I think, researchers and scientists have been thinking about this a lot lately because, we have to be creative. We still want to do our science, but how do we get those funds? And what a lot of people don't understand is that even if you're working for like an Ivy League school, that money that they get is earmarked for specific purposes from different donors. So say, for instance, you have a donor or something like that that gives money to Yale. It can only be used like in the business school, or it could only be used in the law school, or it could only be used for sacred music. So that means like it looks like they have a lot of money, and they do, but they can't just take it and say, hey, we're going to use this money from this pot and use it to do maintenance on our MRI machines, because that would be like illegal. So that's the thing of not understanding, like, well, why can't they just fund, public health research? But it's because they have all of these different specifications about where they get the money from and how they're allowed to use it. And then in terms of philanthropy, it's kind of similar. So a philanthropist is not going to be like an objective, like, board of trustees or something like, where they're, like reviewing grants on the basis of like scientific integrity. Maybe they're going to be like, I have this personal experience and I want it to be used for this research and this research only. And I only want it to be for pharmaceuticals, or I only want it to be for basic science. So that means that like researchers have to be kind of like funding seekers, like of advertising what the importance of their research is. That can be really hard for really basic scientists, because sometimes the innovations that they're getting, they don't know what it's going to be used for. but it down the road probably could save someone's life. You know, they just don't know what it is at the time because it's such a basic level of like cellular processing or something like that.
Yeah. So it's like you're working in it, like, as in essence, you're doing all this great work, but it's all in the background, and no one. Which is now we're having this conversation, and you know, one of the questions I asked in the beginning was to put it in layman's terms so a person like me can understand what it does and the function of it. And it's not something that's talked about in the light that maybe even given the light that it should be given, because it's such important work, right? That helps protect us as a society. So without the recognition, without the understanding being out there, I imagine that it's very difficult to try to raise the funding that is necessary, which is a great reason why we're, you know, to be able to get this out, and hopefully we'll be able to get this, have as many people as need be to view it, so that we can increase funding, increase interest, increase the understanding of the public and of the importance of what it is that you're doing.
I mean, I think all of us are touched by caregiving.
Absolutely.
Yeah.
And pretty much all of us are touched by dementia in some
Right,
way
yes,
within our
yeah.
family. And, you know, there's definitely going to be a need to have more supports. And I think a lot of people just kind of want to get that magic pill that will just cure dementia. And they don't want to have to worry about all of the stuff that public health and caregiving support, like infrastructure, gives you.
Right.
They're just like, that's not going to happen to me, and probably by the time it happens to me, they're just going to have a drug for it.
Yeah.
So I don't really have to worry about like taking care of caregivers right
Right.
now, or that's a private family matter and that should be up to the family. But as people probably can experience themselves, like, it's a lot of work to do caregiving, and you need a lot of help from your community and from services. And we can't just all be piling up at emergency departments,
Right,
you
right.
know, when some kind of crisis happens to our older adult family member.
Absolutely.
Yeah, and some people do this working silently, you know, so you don't know, and some of them don't know how to go by, you know, making itself visible to people with money or to find them funding and what have you.
Yeah, people who are doing this work are not in it for like making lots of money.
Right,
They're-
no,
You know,
not
people
for
who
money.
get into like aging research, I think a lot of them do it because they have like the passion for it.
Right.
And I just went to a talk by George Kushel, who's the head of the University of Connecticut Claude D. Pepper Center for Older Americans. And he was saying that it's kind of hard to get people into geriatrics, but once you get them into geriatrics, they don't leave. Like, they really love it. But it's like selecting for people who are gonna like to work with older adults.
Right,
So
right.
that's the thing.
Yeah,
Yes.
I think it's a labor of love in most instances, right? Even from what we do,
Yeah, it's
you know,
passion.
it's a passion, because I'm more into it because I really genuinely like working with seniors
Right.
and just spending time with them in general.
right.
But you know, are there places and fields that you can go in and make a lot more money? Absolutely. But it's all about what you enjoy and what you know, what your passion is, and finding your passion in life and working in that. Because, you know, I want to be fulfilled at the end of the day, and you know, I'm pretty sure you find your work very fulfilling.
Yeah, I think it also has to do with when you were younger, kind of how you were raised.
Right.
And again, I was like raised in a Greek Orthodox church, so there's a bunch of older people around me that I was singing in the choir with, and that I hung out with every Sunday. And then I also had like a big Greek family with my papu and my nana, and we would go there for dinner every Sunday. And I was always the cousin who would stay at the dessert table and listen to all the older people talk about like all the gossip. And you know, my little cousins would be like, "Oh, don't you want to come and play?" And I'm like, "No." So I think that has a lot to do with it
Yes.
too. I like stories. I
Oh,
like
yes.
hearing about people's lives.
Okay, great.
Yeah.
Yes.
When it comes down to when we're talking about, and we mentioned dementia, and when we're talking about the caregiving aspect of it, we're talking about the funding of the research in all these different areas, and even the funding that's available and the opportunities that are out there for the caregivers to get assistance, or the people who are living with cognitive challenges to be able to get assistance in the home to be able to help them. It's very difficult. And Bridget and I,
Yes.
right now, there's a couple we have it in the family.
Yeah.
We also have it with certain clients that, even veterans, right? And I have to say we have to do a better job of taking care of our veterans, for sure.
Oh, yes.
And we have a couple clients who are vets who have cognitive challenges or facing cognitive issues, and the amount of assistance that they're willing to give them or provide for them is terrible, because it's not enough. And in some instances, we're talking about very much older Americans who are primarily being cared for by their wives or their husbands, and they're up in age, right? Probably in some instances in need of assistance themselves. So when I see it and I say, here's a person who served our country, a lot of them, when you're talking about boomers, have even served during wartime. And it's made great sacrifice for our nation, for our freedoms. We have to do a better job of repaying those sacrifices and providing care for them.
Absolutely.
Yeah.
And they've been exposed to traumas
Yes.
that we don't even know anything about.
Imagine.
And with cognitive impairment, who knows how they're being affected at this point
Right.
with reliving some of the stuff.
Absolutely.
Right.
Absolutely.
Yeah.
And, then when you add that in there, because that's something that, that gets pushed to the back of your mind too, that, wait a minute, what kind of trauma did they suffer in those times of service? And even outside of that, it just goes to show, right, the importance of getting the information out here and making the public aware, so that maybe, maybe what we need is an outcry to the government to say, hey, wait a minute, don't forget about us. Don't, when you're pulling back, it's not maybe not to pull back. Maybe we need more, or maybe we need more. Maybe when you provide the resources, maybe we need better oversight of how they're utilized. But we need it. It's much needed, and it's not what you're given is not what you were given was not enough. Certainly now, it's not enough.
Yeah, there's some really nice programs at the VA, the West Haven one that's near Yale, with music therapy and like equine therapy and things like that. And they also have a model of like the holistic patient. So all of the people that are treating that person talk together in a team. They also have really good caregiving resources. And one of the things about the VA is that they're able to kind of be really coordinated with each other, unlike lots of hospitals. Like
Right.
they can't make the same policy as easily as the VA. So they've been able to like roll out these really helpful initiatives. But I think one of the issues is that a lot of the VA hospitals are not accessible to a lot of people, right? We have to live right in New Haven area to really access a lot of that stuff, versus someone who's like maybe around here or in Western Massachusetts, like the closest one you can drive to for a really long time.
I think that's it.
Yeah, I think that plays a big part in it as well. Yeah. And also, we just had which was, very powerful and even inspiring. We just had Erica Francesco on.
Oh,
yes.
amazing.
Yes.
And,
Yes.
we had Marianne LaFrance, who's living with cognitive challenges as well. She's
Yes.
also a professor from Yale.
Yeah.
And just getting to see that, wanting the public to know that this is real and it doesn't discriminate. It doesn't. It's not something that you can say, well, I live my life this way. I live in this area. It's not going to affect me. No, it doesn't. It doesn't matter who you are, what your educational background is, what your tax bracket is, where you live, if you exercise, don't exercise. It's a reality is that it doesn't discriminate.
Right.
So every bit of energy that can be given to the research, to the education, to the treatment needs to be put forward because this is really prevalent in our society now. And I don't know, from your perspective or from where you are the numbers increasing, and is the increase based on the amount of seniors we have aging, or is it disproportionate in a way that says that it's more popular now?
So it's mainly driven by how many older adults there are increasing in the population, because things like control of blood pressure has decreased, like the vascular types of dementias by a lot, but our population and the world's population is growing by a lot. So that means dementia is going to be growing by a lot. And we also kind of all have to be thinking that it's a high probability that one day we will have dementia.
Right.
So when we think about this, we need to be thinking about ways that we can understand whether we have a risk for it or have it at the very earliest signs, because apparently, the research is starting to show that you could see like 20 years earlier that someone was going to progress to dementia. And if we can see that super early, that means it's probably better to target at that stage before it already kind of like made all those plaques in the brain, right? Like if we could see that it's happening at the very earliest signs, I feel like we have a better chance of the medicines or any of the therapies to work then. So that's why research really needs to be done, I think, on younger populations to understand like what are those like pre-clinical signs, because we know that things like healthy lifestyle and managing your blood pressure and socialization do a lot to slow cognitive impairment kind of once you're in the early stages of dementia, and also can prevent dementia to some extent. But what if we knew like when we were 44 that something was going on and then we could do something about it then?
Now, when you say 20 years in advance, I'm sorry, Bridget, but she just scared me. So when you said 20, there are signs that present that will say that this person is susceptible or basically on course to have dementia in 20 years?
Yeah, I mean, there's some early research to show that there are like signs in the body that can kind of predict. And that's not my area of research.
Right.
So we would want to maybe get someone on your show that knows more about that. I can ask like some of the people from the Alzheimer's disease research unit. But I know that in the circles of like dementia caregiving research and dementia education, that is something that people are talking about, is trying these therapeutics like earlier in the course of dementia, and then also identifying things much earlier in the lifespan to see like how things are unfolding in the body, right? Because things like obesity change, like the vascularization
Right.
of the brain. Like everything is connected.
Right.
And so usually if we target, something, if we get people to do physical activity, it's going to help on multiple fronts. It's going to help the brain. It's going to help like the rest of your body, like your muscles, your weight, and all these different, your emotional health. So that's why rather than waiting and getting like pills for each one of like the outcome symptoms,
Right.
like let's start with preventive medicine.
Right.
And the thing is, we just don't do that in the United States.
no.
We wait until you have
Time.
every multiple chronic condition and then you're taking 5 medications.
Right.
more.
Right.
Right. And that's probably what we're, a lot of what we're aiming for with our podcast now, and why we changed the name to Aging Wealthily, because we want to teach our audience how to age with intention, right? And taking control of their bodies, taking control of your mind, taking control of your finances, right? And being able to have your own direction and direct your life and your future in the way in which you want it to go, versus having to depend or wait and just drifting in the wind, and hoping circumstances permit or something comes along that will permit you to, be able to age well. No, this is about doing it and taking charge of it and knowing the right moves and understanding the right steps to take to be able to do it and accomplish that.
I love that, because I think it's setting up your own environment to
Right.
set yourself up for success. Like if you live in a neighborhood that has like a McDonald's like right next to it,
Right.
and you're like on the way to like whatever your job or something, you're gonna stop at that
Oh,
McDonald's
yes.
like really often. But like, what if you're able to live in a place that doesn't have McDonald's next to it? That already probably increased your lifespan. Like,
Right.
no offense against McDonald's. Hopefully, they're not watching this
It's
podcast.
not just McDonald's.
Yeah, like fast food,
Right.
like everything
Yes.
that is
Yeah.
out there that is maybe not the best type
Right.
of food you should be
Right.
eating all the time.
Right.
Yeah, but you're absolutely right. And I have a McDonald's right around the corner. Actually, there's 2. Either way we go, there's
Right.
I'm trying. It's about us learning the discipline to be able to say no to it, and say no. I have to, I have to take charge of my diet,
Yeah.
right? To make sure that I'm able to enjoy the benefits of aging wealthily for a long time. Right?
Yeah.
And that's what it's.
I mean, it's a lot of responsibility on our own willpower to do that, though.
Right.
So a lot of the times it's kind of better to just and not put yourself in a place that has all that stuff, like
Right.
social media, for instance.
Oh, yes.
Like I found
A lot
myself
of
being like
recipes.
addicted to like certain apps that I would just be checking all the time, and well, not even that actually, but I finally was just like, I'm just gonna take this off my phone, and now like I still have the account. I could get to it on my computer if I
Right.
wanted to, but it's been kind of really nice because like I just don't have that sensation anymore to like go check it because I can't.
Right.
But if it was there, I definitely would.
Right. Right.
So sometimes you kind of have to like make these environmental kind of changes rather than just relying on like, I'm going to be better. I won't do it,
Yeah, yes.
like, because a lot of times that's just not how it works.
Right.
Absolutely.
Yeah.
Absolutely.
That's a great idea. Take it off your phone.
I think that's a great idea. And I think also that in essence of what you're saying is, we can put ourselves in these better environments and try to create a better environment for ourselves. And I think that also we have to call upon there needs to be, some people, they buck against oversight at every range. I think there needs to be oversight, especially when it comes to things such as social media. All right, because there's so much stuff coming at you on a daily basis. And for younger people who are more easily influenced, right, that they actually buy into a lot of this stuff. And I think it causes a lot of mental health issues amongst the younger generation. And I think I see that a lot more now than I did, or I even recall seeing when I was even, much younger. It has to be some kind of way to say, regulate this in a way that kind of stops. There's bullying going on social media. There's, a lot of these misconceptions, people cherry picking moments of their life to put on social media, and they're creating this illusion that they're doing so great when the reality is much different. I think there has to be education. As parents, we have to educate our children and talk about these things and, kind of show them the reality. But also, I think there has to be some sort of oversight.
Yeah. And in terms of, caregiving, it's interesting because usually we thought of like the earlier generations of caregivers as not being as into social media or technology, but now everything for caregivers is social media and technology. And I think we're kind of a little bit behind the times on that research of how people are being influenced, because I've heard people using AI chatbots to get caregiving advice. And so far, like the ones that I've seen, it's just drawing from helpful advice from, pages like the Alzheimer's Association, things like that. So that's fine, right? Right. But what if there gets to a point where it potentially is giving other types of advice about caregiving and how to handle your role as a caregiver, and how are the new generations of caregivers going to be kind of affected by the information on the internet in their care for older adults, and older adults themselves who are receiving care are like the biggest targets for fraud.
Oh, yes.
And so now becoming a caregiver is about guarding your loved one from fraud, which is like a new caregiving responsibility that we haven't really intervened with that much, right? And sometimes the financial abuse happens from the caregiver to the care recipient.
Yes.
So then how do we help caregivers not feel like they have to be in that position to do that, right? It's not about like they're a bad person.
Right.
It's probably that they don't have the support they need to be a caregiver.
Well, that's possible. We also have to be, one of the things when we have our company meetings all the time is we talk about, and we always remind our staff that we work with a population that's extremely vulnerable. And when you work with this population, you have a great responsibility as a caregiver, and you have to safeguard this person in any way, in every way that you're capable of doing, because they are vulnerable. And they're dependent, and the relationship sometimes is so fragile. Sometimes you're working with a person who is fragile. They're isolated sometimes and alone. Sometimes they're going through emotional changes because of whatever condition that they're dealing with. Maybe they're going through some decline. It's very difficult for them, right? A lot of times. So, we often remind them that they're vulnerable. It's a privilege for you to work with this population. Also, that we are constantly available for them as caregivers. So if you have a question, Bridget's been in caregiver for over 30 years. She's worked in this field for over 30 years. If you're running into a problem, an issue, call her.
Right.
Call the office. Call her, because I can guarantee you that if it's something that you're having difficulty with, she's probably experienced it. If she hasn't, she knows someone who has or knows of the situation and can help guide you through it. So there is really, it benefits to have that, and you have to rely on that. So I don't think that you're maybe you're a good person at heart, but if you take advantage of a senior, good is out the window.
Yeah. Not like there's no consequences to it. But in terms of thinking about how we prevent it, I think the stick is not the way to go. It's trying to give more caregiving support so that people don't feel like they're backed into a corner having a horrible relationship with someone because they don't have the skills to be able to react to like negative comments or things that are like hurtful, maybe that aren't the fault of the older adult.
They get the pillory. Like medieval. No, I'm just kidding. No, we need support. Everyone needs support.
Yes.
Because even then, being overworked, being stressed out, makes you vulnerable. Right. And in those states and in those times, we don't make the best decisions.
Yeah.
Right. So when there are things that come about, that's why it's important to talk. Right. And one of the things that last month was, a mental health awareness month. Right. And, one of the things that we've been preaching, right, because we've had a crisis come along in our lives, that we've been preaching communication. Talk about it. Because you're not the only one.
Yeah.
You're not the only one. You'd be surprised. I was in a situation once, and I was having some feelings and just not feeling good, right? Not in a good place. Just, emotionally drained and not, just didn't have it, right? Sometimes we get there. Just didn't have it. And, I actually went and talked to some people, and they, just to find out, and then, how many people said that they were feeling the same way as me? And I was shocked. Because I was like in a position where I was like, I don't really want to tell these people this. No, this, oh my God, me too. I didn't know you. And then a conversation ensued amongst us and amongst this group of people who we were all feeling the same way. And guess what? When we walked away from there, we walked away with some solutions to some of the ways we were feeling, some workarounds and some ways to work through it. And I walked away from there feeling recharged because just being able to talk about it was like lifting a building off of you.
That's the hard part. Some people not able to talk about it.
No, you can talk about it. But what hurts you is that what happens, we hold it in and we get in outside our own head. And once it's in there, I guarantee you it's far worse in your head than it is outside in the open.
Absolutely.
Yeah, but you got to convince them that it's better to talk about it.
But that's the thing. Yeah. We have to, and this is what we're doing, right? I mean, we've been talking about this for weeks now. Talk about it. Get it out in the open. Talk about it. Because you're not the only one. There's nothing anyone's going through on this earth that you should say, I'm the first person in the history of the world to ever go through this.
There's a couple barriers that can happen for caregivers and not wanting to talk about, like dementia, for instance. Like, say your spouse is starting to have like signs of dementia.
Right.
A lot of people will say, like, I don't want to betray them.
Right.
I don't want to lose all my friends.
Right.
So there's really no one I can talk to, or I don't want to worry my kids or things like that.
Yeah.
And that's why I think we need to change like the stigma around all of it, because so many people are in that same situation thinking they're all alone, just like you were saying. And I see like a lot of men, especially, that don't feel like they can share their emotions or their needs because they don't want to be seen as weak. They want to show that they're the one who can like be strong enough to take care of the family, or they and maybe they just haven't been socialized in the same way as like ladies do, where like get all together and talk about everything.
Right.
They're more like going to talk about like football or something like that. So it's just kind of changing and having like role models like you probably to be like, here's a successful guy who is able to ask for help when he needs it. And I try to think about that with my 16-year-old son, it's like, it's okay to come and talk to us if you're having something that you're worried about. And we're not going to think you're weak. It's actually more courageous to say that you're feeling upset, because you need to be able to express that in words. Otherwise, it's going to come out in another way. Violence, whatever. So, yeah.
Yes.
Everybody needs support, but I think
Yes.
men maybe need a little bit more support with that right now
A little
too.
more.
You know, I'm surrounded by women now, and but I will admit that men, we have to, and this is part of the work, right? Is to get men to understand that you're not weak by talking about these things. In fact, discussing them will make you stronger.
Right.
Will make you better able to lead, will make you better able to provide, will make you better able to guide those who you're responsible for. And and make it easier and better for you to be able to take charge of your own circumstances. Right? Information is power. And we don't have the information until we're connected with it. There's so many resources that I gain, you gain, Bridget, you gain, just from talking to other people. Because we can't know it all, right? Sometimes you talk to somebody, you don't even realize they point you in the direction of something and it may be the answer to a question you may have. It may provide information on a subject that you were looking for information on, but we don't have all the answers. And we talked about this in one of our segments, is that, you know, a lot of time, right, in society, people think that, you know, we're independent, we're our own island, and human beings are not created to be independent. This is not who we are. Human beings are interdependent upon one another. Because if it weren't that way, one of us would know everything. And none of us know everything. We need, just like building a house, if we need carpenters, we need plumbers, we need electricians, we need all these different disciplines to be able to come together to build a house that's livable.
Yeah.
Right?
That's a great link to caregiving research too, because if you think about it, it's one of the most interdisciplinary things that you can think about.
Right.
Like when I do research, I'm a psychologist, but I need to like sometimes have like someone who knows about immunology, right? Like if we're studying like the immune system and the effects of caregiving,
Right.
or, you know, maybe I need like a statistician on the team to do some complicated types of design and analysis, like if your question is really complicated. And one of the things I love about public health is that it's not one discipline, it's all kinds of people working together. So you have like MDs, you have like cardiologists, you have psychologists, you have sociologists, you have anthropologists, you have biostatisticians, you have economists. And instead of like studying an issue from just one area of like science, you have a team of people who are thinking about it all together from all those different points of view. Now, sometimes it can be a little bit hard, but you know, I think we've gotten a lot more training in this idea of team science, because back in the day, it used to be like, oh, you just had to have like your own lab where you knew everything what you were talking about. But the cool thing about public health specifically is that it doesn't try to do that. It says, caregiving is the issue we need to solve. Who needs to be at this table to help do the research to solve that? And that's something I really appreciate about public health. Well, when you become a scientist, it's good to really understand like one discipline in depth so that you can become part of that team and really know your stuff. But at the end of the day, it's super fulfilling to just constantly be learning from nurses and what they learned, and occupational therapists. So like Erica DiFrancesco, I learn from her all the time, you know, because she's occupational therapist. And I didn't get to learn a lot of that stuff in my discipline. So, but we're working on the same issue together, which is to decrease dementia stigma.
And all are needed.
Yes.
Yeah. And it's like you perfectly well put, because even when you go to hospitals and rehabs and all those things, they have an interdisciplinary team, and there are different disciplines, different people from different backgrounds, different disciplines that sit on the team to help make decisions to guide this person's recovery or treatments. So I think that's a very good analogy. From the public health aspect, what is needed to help, and you may have touched on this answer to this, to help bring about the awareness that we need overall to be able to move this forward?
I think on a very personal level, we need to share our experiences with each other. Just in the example that you gave, is that you came together with your community and you said, I'm dealing with this stuff.
Right.
And is there anything that we can do together to solve this problem for
Right.
all of us, not
Right.
just one of us?
Right.
And I think really understanding what your neighbors are going through and taking those small actions every day kind of puts it in your face and shows you like the good you can do, right? Because everything kind of seems really overwhelming, like, especially right now, of like affecting change and things. But I think we also just need to maybe vote for people or have governments that do things more for communities
Right.
and for prevention rather than other types of uses of money that are not for the health of the
Right.
public.
Right, right. So, do you have any networks or agencies that you would like to direct the audience to be able to get some information, get more information about this, some of your work that you're doing?
Yeah. Well, obviously, there's the Alzheimer's Association, and they have really helpful information if you're a caregiver dealing with dementia on just practical issues like
Right.
how to communicate in the early stages, the mid stages, the late stages. And they have so many support groups. They're kind of like the most common support group
Right.
to find. And if you can find a support group, that can be really helpful to just open you up to things. If you're in like the New York City area, Caring Kind is another one of those. It's kind of more of a community-based
Okay.
approach. And then Live Well Institute and the Resilient Living Center. If you're anywhere near Southington area, Plantsville, check out the Resilient Living Center. I go there pretty often because it's such a cool place to
Oh, yeah.
hang out at.
It
Like,
is.
you don't even have to have dementia.
For
Like,
real.
it is really cool. And anybody can be part of it. Like,
Yes.
you can learn how to like make sushi
Yes.
on an evening, or they're going to have like a summer concert series. So those types of places, and they have these places kind of like everywhere potentially, but you have to know about them.
Right.
And that's one of the issues I'm trying to work on right now is like, how do we get these different places on people's like maps,
Right,
like how do we get them to, and one of the issues I think that's hard is like for community centers or like senior centers, a lot of like the boomers don't think they're old yet. So
Right.
if you go to a senior center, they'd be like, there's a bunch of old people there.
Right.
I'm not going.
Yeah. Right.
So it's just like, what is kind of like the bridge to that for this generation who's aging? And I don't know, I'd watch my aunts and uncles and
Yeah.
my parents and stuff to see what they're doing. But I think we need like a more concerted effort to figure out how to embrace community a little bit better in the aging population that doesn't think of themselves as like the silent generation.
Right.
Right.
And there's a large population of it.
Yeah.
Yeah.
One of the things we're thinking about is one of the segments that we have coming in the next couple months, we're going to be going out and profiling communities. And we're going to, go in and do the walkthrough, bring the camera, film it, talk to the staff, talk to some residents, make a nice video about the community, give an honest feedback and review on the community. And then we're also going to post those reviews on our channel so that our listeners can be able to go and take a look at them and see and find out about the community.
That's so amazing.
Yes,
That would be
yes.
so cool.
Yes.
Because you're often just like, people will be like, oh, have you heard anything about this place? And have you
Right,
heard
right.
And it's like, I randomly know some information, but if you had like a virtual like tour that was independent from the place itself, like
Right.
of a trusted duo like you two, I think that's going to be amazing.
Yeah, it's gonna be.
Totally excited.
Yeah.
Yeah.
It's like restaurant reviews.
Exactly.
Or resort reviews.
Yeah, resort. Yeah.
When you're going to
Yeah.
travel, I always go
Yes.
on YouTube. I look at the resort and
Yes.
But yeah, how much more important is it than where you're going to either live or where you're going to go for activities and treatment? I think it's very important. Very important to have that. That unbiased. Look.
Yeah.
Yeah.
And we're like a consumer generation. We're going to be like, we want to live here. What are
Right.
the amenities? What's it going to give to us? Right. I think it was a little bit different before. It's just like, oh, we're going to put our parents in this nursing home. They
Right.
don't get a choice.
Right.
Like now
Right.
we're just like, okay, well, when I get older, I'm going to live in one of the river homes out Little, and then I'm going to do this,
Yes.
So
Thought this out.
Yes.
I might try to live there on my sabbatical or something too. But
No, it really is.
Yes,
Yeah.
it is. It is. I said the same thing. I think this is where we're gonna live. It's really nice there.
So we have our lightning round coming up. You ready?
yes.
All right.
Where's my buzzer?
So we're gonna actually, the lightning round, and it will give you a chance to talk about another piece that we're going to be doing, and it's going to be coming out on a daily basis. So we have coming next week is where we're going to have a segment called Shattering Myths, and we're going to be going in and busting up these myths that we carry that limit us, right? Because we always have a bunch of limiting beliefs. So we want to take those myths. We're going to discuss them. We're going to shatter. We're going to reframe them, and then we're going to bring about the truth, so that people can build upon the truth and get rid of those limiting beliefs that we have.
Yeah.
But so, I just read it in one of the questions that. So maybe you can you're going to be able to give get rid of one of them right now.
All right.
You got it.
Yeah, okay. What's your favorite aging myth to bust?
I think one of my favorite aging myths is that older adults can't learn new things. too
Okay.
late.
Yeah.
An old dog can't learn
new tricks. Right.
Yeah.
Yes.
And that's absolutely not the case.
Right.
And that really protects you from cognitive decline
Right.
if you learn something new.
Right.
So they often say like, oh, keep your mind active, but it's not enough to just keep it active on something you already knew how to do.
Right.
That's active.
Yeah.
You have to kind of flex it in a different way.
Right.
So take up kickboxing or whatever if you've never done that before. If you've always played tennis.
Right.
Yeah.
Okay. Most moving caregiving stories from your research.
I think one of them was one of the interventions that I helped create. I was doing this study to see if it would work, and I just wasn't sure if it was going to or not, And there was this one man who did kind of my emotion regulation training thing and was using it in his life, and I found out he was like telling everybody to do it.
Wow.
Like at his caregiving group and everything.
Wow. So,
And he just told me the story about how he was like in his kitchen. He just was super stressed. He didn't know what to do. He was just like standing there. And all of a sudden he was like, I'm going to do a whoop. Because my intervention was called WHOOP, Wish Outcome Obstacle Plan. And he did it, and he felt like he was in control again. And then he was able to move on and keep going throughout his day. But one of the things, like when you get so kind of academic and intellectual, you're like, yes, this is going to work because of this cognitive behavioral therapy strategy and things like that. But when you actually hear that it kind of like saved someone in a specific moment and that it meant so much to them.
right.
That's one of the most like meaningful things. And I was like, I don't care if this whole randomized control trial works. Like just the fact that my one friend was affected by it is enough for me.
Right.
You know?
Right. Yeah,
So those are the kinds of things where you get to see the real impact for people. And,
Right.
it makes you feel like you should keep on doing it.
Right.
Wow.
That's really nice. Okay. Your dream private sector collaboration.
With you guys.
Oh, that's special.
Right.
Okay. On you, Smith.
So, Dr. Monin, I really want to thank you for coming and joining us today. And is there anything that you would like to leave with our listeners before we sign off?
Yeah, I guess I just want to say that, if you're starting to feel like you have cognitive impairment, it's okay. There's people out there who can help. You're not alone. There's so many people going through this. And don't feel like you have to keep it hidden from yourself or from others. It's good to ask for help early because it can stop things from happening in the future faster. And then you might not have as much to say about, how you want to live. And just because, there's so much dementia stigma out there, there's a huge movement of people that are working to decrease this stigma. And I know you've had other guests on the show that have that mission, but I'm one of those people that want to do that because who knows, like I might have dementia one day and I want to think about how people would treat me. And I want to be able to get the support that I need. So we're all in this together.
Yes.
Absolutely.
Yeah.
Absolutely. Very well put. So, Dr. Monin, again, I want to say thank you. I always when you leave my presence, I've always feel so inspired because it's really inspiring and refreshing to see such an accomplished young woman. You're very young to have made the accomplishments that you have.
Yes.
And you are just continuing to move forward. And I know you are going to accomplish many more great things in your lifetime. And I really mean that sincerely.
Yes.
You always have a home here on our show, and we were going to have you back many, many more times because we have a lot of work that we have ahead of us. And we're going to do some things to help change our communities. I know this, and I believe this from us.
Thank you so much. Such an honor, and I really appreciate that your reflections about my future.
It's good.
Yes, but it's been wonderful having you here.
Yes, it is. Thank you for joining this episode of Aging Wealthily. If you like our content and you want to hear more, like and subscribe to our channel on YouTube, Aging Wealthily. If you're in the Middletown area, stop by the Main Street Marketplace. There are 4 great restaurants in the building and lots of specialty stores. If you are in need of office space, looking for a place to launch or grow your business grow your business, there are some great office spaces available. Contact Mike Stone at Stone Point Properties. There are some great office spaces there, and it's a great environment, a nice family atmosphere. This episode has been sponsored by A Touch of Love Home Care, where we put compassion in every action, love in every touch. If you have someone who is in need of assistance, give us a call at 203-927-7543. That's 203-927-7543. Have a great day. Make today one of your best days ever. Bye for now.